OhioMeansJobs Champaign County is committed to assisting local employers in finding qualified employees. This video series provides realistic previews of local opportunities available and the necessary skills and characteristics preferred for a person seeking employment.
My name is Micah. I'm a RN hospital supervisor. I've been at Mercy since 2008. I've been at this hospital since 2012. A typical day typically involves receiving handoff from another hospital supervisor about the shift and the most important needs of the day, regardless of what the needs are or who they're for, whether they're for a patient, a family member, a coworker. It doesn't matter. The most important needs I have to address first and typically have to follow them through until I find a resolution. I have very much a working role here as a supervisor. I often participate in patient care if needed. And then of course I've helped the managers resolve any of their issues as far as documentation or quality or paperwork. What I love about working at Mercy Health Urbana the most is I work with a stellar staff. I've worked for quite a few different networks, so I've found that Mercy Health Urbana is really no different than the rest of them. But what I appreciate about the people that I get to work with here is that it's kind of a small community atmosphere. Everybody gets along. It doesn't mean we don't have our disagreements or problems to get through, but it's really what you make of it. And what I like about this place is everybody brings something, their own talent, and tries to make it better. And it's a day-by-day process like it is anywhere else. But this is definitely one of the better places that I enjoy working at. And that's has a lot to do with the staff, the type of clientele we have, the cleanliness of the place, the quality of the place. It's definitely overall a better atmosphere than many of the other places I've worked at. One of the more difficult things about working at Mercy Health Urbana, a lot of it pertains to access to resources. For example, this is a smaller facility. We're a critical access hospital. We can't necessarily pull from other units all the time like you can at a bigger hospital. So your talents to help resolve issues here are much more useful. And so you get that opportunity. So that being said, there's a lot of times staffing issues that we have to resolve on the fly. So, but again, that enables us as individuals to be adaptable. So that's one of the more difficult things you can see here. But at the same time, it's an opportunity to kind of draw from your resources, your personal qualities, and help resolve problems. Characteristics and skills that an RN hospital supervisor would benefit from are critical thinking skills, being able to think quickly, depending on the situation, and primarily being able to draw from experience. And obviously having a wide skill set helps because you can need to jump in and help in any department, in any situation, regardless of what's going on. It might involve resolving a family member's issue or something a physician needs, and or a staff member or a patient, of course. But ultimately, your experience plays a large role here in what you're capable of using to resolve issues. I choose to work at Mercy because they gave me a chance as a new graduate RN and have supported me over the years. They're also close to home. It's a small family atmosphere, more or less here. I've worked at other healthcare networks, and I try to find the most in each situation or place I've worked, but Mercy has supported me through all the different positions I might have participated in here, and they continue to do so.
Contact us today to learn more about employer services available through OhioMeansJobs, Champaign County.